I spoke about clonal hematopoiesis, which is a very common state that occurs with aging, not a disease in and of itself, but a precursor condition potentially for both myeloid neoplasia, including MPN, and for vascular events and other complications as well that we're progressively learning about. Interestingly, it may actually be protective against Alzheimer's dementia, which is a fascinating observation. At the moment, we don't know of any way to prevent the progression of clonal hematopoiesis or to prevent complications such as coronary artery disease, related events, or ischemic stroke. However, this is an area of very active investigation. A number of medical centers have opened precursor clinics, seeing patients with CHIP and with related pre-malignant states such as monoclonal gammopathy of indeterminate significance. Some of the really key questions around CHIP and around clonal hematopoiesis more broadly are identifying those patients who are at highest risk of complications and at highest risk of progression. There has been some development of risk scores, which helps, but a lot more work needs to be done. There's a lot of different genes and a lot of different interacting factors, so that's one major area of unmet need.